Hi everyone, welcome to Scent of Balance Live. I'm Phua from Scent of Balance, the acupuncturist. Right. Today our topic is acupuncture for chest pain. So this topic is more like for acupuncturists. If you an acupuncturist, so this is gonna be benefit for you. So more likely for more suitable for acupuncturists. And tomorrow we're gonna do an acupressure point topic for chest pain as well. So tomorrow's topic will be more for general for everyone, including acupuncturists. If you're not an acupuncture practitioner, and that is suitable for you as well. But if you're not an acupuncturist, you would like to, just watch this and stay with me, and that's fine too. Okay, that's not a problem. Okay, always welcome any kind of any of you to keep sit in front of me, then supporting me. Right, let's get all the platform on. Hi Eric, how are you? Right, so our topic is acupuncture for chest pain. Hi Veronica, thank you, good morning. Now, we know chest pain that come with a lot of it can cause your heart, lung, stomach, gallbladder, or as for the injury. Okay, now I'm gonna give you this strategy. It's called KP Yang. So this strategy are very good for chest pain. It can help with stomach problem, acid reflux causing chest pain, heart causing chest pain, right? And if it's injury, like you got hurt in the chest and it causing chest pain. The reason we look at here is because when we treat the meridian, it treats the organs as well. It treats the organs as well. Therefore, it treats the organ as well as the muscle in here. When we say about meridian, that's what I look at it, okay? This is kidney meridian over here. So patient always ask me, well, is meridian nerve system or vessel system or muscle system? And my answer is always meridian, including all I just mentioned, the above. Why is it? So look at here. If this is this is kidney meridian, right? So the kidney meridian control the skin over here and the muscle over here. And what else? The bone, which is the ribs over here, right? Around here. And what's in it? Inside here, there's lung. Control the lung here, control the nerve here. Okay? And also control the heart. Heart's more in here, right? So there's another meridian, kidney here, kidney meridian, heart. And as well as what? Because we call it kidney meridian. Kidney meridian directly connect to kidney. So the meridian of kidney meridian, it controls kidney as well. It can treat the kidney as well. Does it make sense to you? So which means kidney meridian flow from here down here or in here. So it controls anything inside over here. It can control what? Stomach, because stomach's over here. It can treat stomach. It can treat intestine, because intestine here. It can treat what do you call it? Uterus, reproductive system. Why is that? Because kidney meridian go through here. Whatever it run through, the pathway run through, it cover the organs, then it can treat that organs. Does it make sense? Right. Now we know this, that meridian run past any area and then it can treat that area, as well as the organ. Because we name it kidney meridian. Okay. Then what happened in here? This strategy. Oops, sorry. This strategy called KP Yangming. KP Yangming. Okay, I'm gonna name it out. You're gonna write it down. All right. So the KP Yangming is large intestine on that side, 1-4. Is this KP Yangming? No, this is KP or Jin Yangming and KP Yangming. Okay, yeah, it is. Both of them. Okay. Yangming, large intestine 1-4, and K kidney on that side too. K14 as well. So large intestine 1-4, K14. And on the opposite side, which is pericardium 6-9, stomach 42 and 45. Stomach 42 and 45. And you can add on liver meridian, which is liver 1-4. When do you add on liver meridian? When there is liver meridian symptom appear, or when there is stress causing chest pain, then you can add on liver meridian 1-4. Okay, so which means in here is KP Yangming and Jin Yangming. Two different balance in here. Okay, now this is treating over here. If pain in here, you can use this strategy. Very simple one. Now, what if I saying that, well, I don't want to choose those points? Yes, that's fine too. So what point do you choose? Where do you go to? This is using the image. So the pain is in the chest, right? Pain is in the chest. So when pain in the chest, then we're using image. This is the image of chest. 内关 PC6, right? Yeah, PC6. So around here, PC6 or 7 on this area is chest. So which means when it comes to large intestine, we can use large intestine point over here. I don't know the name of here, called PND. You can use PND, and you can use large intestine 3 over here, because 3 lower over here, it can treat chest pain too. This image. So that you can choose that point or that point, and we come to pericardium on the opposite side. You can treat pericardium 6 or pericardium 7. Now, what about kidney? Same thing. It can treat kidney point over here. Right. That is kidney Phua Ltd. Phua Ltd is kidney 7, I think. Let me Phua Ltd. 1, 2, 3, 4, 5, 6. 6 or 7, something like that. Kidney 7 or 6. Phua Ltd or Jiao Xing, both you can use. And what is the best point? You can get the RC point and needle it. Right. Then what about stomach meridian? When it comes to stomach meridian, you can treat here as well. Pretty similar, like because spleen 6 can treat that too. Okay, So 2 tune or 3 tune come to here. You can get it in here, get an ulcer point over here on the stomach meridian, or flipped over, stomach 36 can treat hard as well, and deeper needles, and they can treat hard. Deep needle, treat hard. Okay, deep needle. Okay, this is the image. Or what about, we talk about what do you call it? Liver. Okay, and liver meridian, of course, over here. Image over here on the liver meridian. You get an ulcer point. It can treat heart problem. It can treat chest pain. And liver 2 can treat heart problem too. I think it's liver 2, is it? Let's see. Yes, liver 2 or 2.5, something like that. Why is that? It's similar to the large intestine 3 or 3.5, something like that. Okay, which is 行间, a little bit 行间, around 行间, and get ulcer point, and they can treat chest pain too. Okay, what else? Now, if patient have chest pain and that's causing from the heart, this can do it. And what about a patient have tingling and numbness on the hand? If tingling numbness on the hand, this will help. Or you can go to the opposite side and use the long needle for large intestine 4. One needle go through here and connect to this pericardium point, and I think it's pericardium 8. 劳宫 must be pericardium 8. This is 9, right? And that must be 8. The second last point of pericardium. So 劳宫合谷透劳宫, which is 合谷 point, last intestine 4 through here, and stimulate, or not 合谷 point, you can use what do you call it? 三间 point around here, get an ulcer point like large intestine 3 or 3.5, something like that. You know, get an ulcer point and needle it and through here and twist the needle gently. When you twist the needle gently, you ask the patient if the patient, or you needle on that side, if the patient have numbness in hand and here, and they can move, they can try to move the hand, and they will take away the numbness instantly. Well, this is what we use in our clinic. This is one of the strategy. Okay, I've used that on my patient. Okay, this is one of the strategy. There are more strategy. All right, I'm just showing you how to get rid of the numbness causing from the chest pain. Because once you put this in, or you use the image to choose KP Yangming, and not necessarily remove the tingling or numbness on the hand causing from the heart. But it may, as soon as you put those needles, they feel better in the chest, and they feel better on the numbness and pins the needle on the hand. But it may not take away this pain or tingling. So you need to add more needles. Let's say if this pain is actually causing from lung, and this can treat it too, but I would also choose Tai Yin Yangming. So Tai Yin Yangming, that is another image, another pattern for chest pain. So look at this. Chest we have stomach meridian and the spleen meridian over here. Okay, and Tai Yin Yang can treat lung as well if it's coughing and wheezing and causing chest pain. But if the chest pain is over here, it involved with kidney. And how do you choose right now? You can choose Tai Yin Yang Ming plus kidney meridian. Tai Yin Yang Ming plus kidney meridian. The reason we can't choose those to combine, like KP Yang Ming and Tai Yin Yang Ming, because this is if you're choosing, if we are using image to choose the point, and there's no problem. You can combine those two. Tai Yin Yang Ming means you use hand tai in large intestine, stomach meridian, and lung meridian and spleen meridian. Right. So the two in meridian change to spleen and lung from kidney and pericardium. But you can combine those two, which means using Yang Ming, large intestine, stomach, pericardium, kidney, plus spleen and lung. And there's no problem. It's just you're not choosing this point in here because this conversion, meridian conversion strategy, you can't change the point. It has to be those points. But if you use image, based on here, let's say based on KP Yang Ming or Juan Yang Ming, then we add on spleen and lung, right? So we just mentioned about the KP Yang Ming already. Then we want to do lung. So lung, how do you treat lung? Lung is over here, so you can treat here. This is your chest. Again, lungs in the chest. You can get access point over here and needle it. Then when it comes to spleen meridian, you choose over here. Any access point, spleen 6, and up and down spleen 6, and get access point and needle over here. Right. You need one needle, you can need a few needles, and they can treat the chest pain as well as treating the lung function, coughing or asthma or wheezing. Right. That's when it's coming from coughing, wheezing. Okay, so two global balance strategy combined together. What else? What if this patient chest pain is causing from spine? If it's causing from spine, I would recommend acupuncture can help. But if it's the joint out of balance, then you need to put it back together. Maybe involved with chiropractor or osteopath. Right? Chiropractor or osteopath. But what can we do? Yes, we can help to put acupuncture needle over here, along here, to help with the pain over here. Okay, we have colleagues that they use scalp acupuncture, put needle in there, and then get osteopath to do the spine work. And they find it much easier and much quicker. And for us, simple. You put needle in here, and then you get the patient to do exercise for the upper back. Do the exercise, okay? Do all physio exercise, and it'll help loosen it up. It may help to put it back together. It may not. Sometimes you need manipulation to help with it. Does it make sense? Right? I think we covered just about everything. Stomach, lung, heart, yeah, and the spine. Yeah, we covered just about everything. Okay. Now, even there's a spine problem, the upper back causing the pain, and those are still, you can still apply those on it, because as long as the meridian is in here, all right, then you can treat it. As long as the pain involved with those meridian, it doesn't mean that the pain has to cause definitely to diagnose is get a clear diagnosis actually from your heart. We use Meridian Diagnosis. We are not treating using this strategy based on Western medicine, based on you have to have an ECG or X-ray, CT scan, or MRI of your heart to diagnose you have heart disease, and we start to use that. No, we don't do that. Okay, we diagnose according to Chinese medicine, acupuncture, Meridian Diagnose. This is using the Meridian Diagnose. So any pain come to the chest, then you can do that. You can apply those. Any pain that involved with kidney, stomach, spleen, liver over here, lung, then those strategy you can apply. Does that make sense? Okay, that's it for today. On the easier part for chest pain, you can just go through that in here. We talk about pericardium, right? You can do lung, pericardium, heart, meridian. On this part, get those 3 meridian, or even between 2 meridian, get access point. Get access point and insert needle, and it can treat. This is local balance. It can treat all pain over here, even upper back pain. But with those strategy, and I just show you the image on my hand and local balance, it doesn't treat the 2 meridian and 1 meridian. Okay, so 2 meridian, 1 meridian in the center, you have to use over here. Head to treat it. Right? That's it for today, and I hope that give you some idea how to treat chest pain. It's a very simple one. Okay, this is just one of the strategy using balance method acupuncture, using global balance, local balance, and different global balance to treat chest pain. And there are a lot of other acupuncture strategy technique to treat chest pain, like using G acupuncture or pulse acupuncture spirit, balancing the pulse and organs. And we can use Chinese herbs, and we can use Tuina massage. We can use Chinese manipulation, all sorts. Okay, and using Chinese herb as well. Okay, and if it's come from stomach and heart problem, then changing diet, changing lifestyle is important. You don't just rely on treatment. Make sense? But our treatment is actually try to restore the function of the organs. Once the organs restore, the organs can function properly. It can maintain itself. I don't agree with just taking something to support, to add on some function instead of treating your organs. Okay, we're not finding a replacement for it. But at the meantime, when we need it, this is a type of replacement of the function. It seems like it, but it's actually not, because we're treating the organs. All right, stay awesome, and I'll see you next time. Thank you, Veronica. All right, I'll see you next time. Bye-bye. You're welcome, Chris. Thank you. I just see your I just saw your comment. Thank you for supporting. I'll see you next time. Bye-bye.